At least 30% of Kenya's population is set to receive the COVID-19 jab before the end of March next year, that's 2021. According to the Acting Director General, Ministry of Health, Dr. Patrick Amoth, Kenya has ordered an additional 12 million vaccine doses to the 24 million doses which will be received from the COVAX facility. Dorcas Wangira reports on this significant milestone and why the vaccine itself is not a silver bullet in the fight against COVID-19.
Kenya has joined other countries in the rush to secure COVID-19 vaccines. According to the Acting Director General, Ministry of Health, Dr. Patrick Amoth, Kenya will receive from the COVAX facility 24 million doses of the vaccine. This particular consignment is free, but the country has also ordered an additional 12 million doses of the vaccines at a cost of 10 billion shillings. The Ministry of Health submitted its request for the vaccines on the 7th of December.
We are hopeful that next year we will indeed start vaccinating people.
COVAX was created by Gavi, UNICEF and the World Health Organization to deliver 2 billion doses of COVID-19 vaccines for millions of people across Africa, Asia, the Caribbean and Pacific, and in Europe's eastern and southern neighborhoods by the end of 2021. The facility says it has already secured millions of ready-made doses of the Oxford AstraZeneca candidate, ready for distribution to the 92 developing countries, including Kenya. At least 30% of the Kenyan population will receive the COVID-19 jab at the beginning of next year, the first quarter of the year, well before the end of March. The first 24 million doses supplied by COVAX will cover 20% of the population as required by the WHO COVAX program. The additional 12 million purchased by the government will cover 10% of the population.
It is not possible for us to have enough vaccines for everybody at once. Possibilities of making sure that we have a priority list of who do we start with, who do we end with.
The first to be vaccinated will be frontline healthcare workers, followed by the vulnerable and the elderly, and priority service givers. Kenya would prefer doses from the Oxford AstraZeneca candidate, although COVAX has a number of other candidates. Dr. Amoth further says, and I quote, "We are open to other vaccines such as the Chinese Sinopharm, Russia's Sputnik 5, Pfizer, BioNTech's and Moderna's based on safety, immunogenicity and efficacy levels," end of quote. But what is Kenya considering before a vaccine is purchased? It must first be a vector carrier-based vaccine. It must be pre-qualified by the World Health Organization. It can be stored in a cold chain, 2 to 8 degrees, and the cost factor. One dose is estimated to cost between $5 to $6.
We also have to keep ourselves cautious. We also have to move cautiously and to ask ourselves the efficacy of whatever vaccines that we are going to use in our nation.
Even with this being a milestone, Dr. Amoth further says, and I quote, "This is definitely a step forward in the fight against COVID-19. The vaccine is not a silver bullet because we cannot cover the entire population. We urge the remaining 70% of the population to observe the COVID-19 guidelines," end of quote.
The silver bullet, for us, at least for now, the silver bullet is our change in behavior, if at all you can call it that.
The Africa CDC has been categorical that leaving Africa behind in the vaccination against COVID-19 will be disastrous for the entire world. If Kenya achieves its goal of vaccinating at least 30% of the population by the first quarter of 2021, this will be a great success. But for the 70% of the population that will not be vaccinated, what is important is to maintain the guidelines that have been there. Wash your hands, maintain social distancing, avoid crowds and unnecessary travel. Dorcas Wangira, Citizen TV, Nairobi.